Today we are talking about steroids, the most confusing topic regarding the people point of view, because a lot of people think about steroids are not good for our body. Yeah, it's true, but not always, because steroids has different uses, and sometimes it's beneficial for our body and sometimes it's not. So it's also depend upon the usage of the steroids when you use the steroids. So we will discover all the aspects of the steroids in this lecture. So let's get started. First of all, we will look what is steroids. Steroids is basically a organic compound that is important in the human physiology and in the medicines. It is produced naturally and it can also be synthesized artificially. Next, misuse, particularly a type of the steroid that is anabolic steroids, uh, has led to various health risks and ethical concerns, especially in sports. What are steroids? Steroids are lipophilic, fat-soluble organic compounds derived from the cholesterol. The most important structure in this steroid is the fused four carbon rings. It has four rings, that is cyclopentanoperhydrophenanthrene ring. This is the most important component in these steroids. Where steroids and what steroids do in our body? It performs the metabolism. It helps in the inflammation, reducing inflammations, immune response, and enhance the growth and affect the reproductive systems. So steroids can be classified mainly into two categories: corticosteroids and anabolic androgenic steroids. Corticosteroids involve in metabolism, immune response, and electrolyte balance. This is the three major function performed by the corticosteroids. While in anabolic androgenic steroids, AAS promote muscle growth and influence male characteristic. As it enhance or promote the muscle growth, so that's why mostly bodybuilder use this anabolic androgenic steroids to promote the muscle growth. So sometimes it is, or you can say it is often misused by the bodybuilders or the athletes for the promotions of the muscles growth. That is anabolic androgenic steroids. Next, if we talk about the types of these steroids, as we have categorized it into the corticosteroids and the anabolic steroids. Next, corticosteroids further classified into the glucocorticoid and the mineralocorticoids. But just keep remember one thing, corticosteroids can be synthesized in our body and we can also take from outside the body in the form of medicines. First is the glucocorticoids. As the name indicate, gluco means it regulates the glucose metabolism. Glucocorticoids like cortisol, prednisone, dexamethasone. These are all the glucocorticoids. Some are natural and some are synthetic. Second function is the suppress inflammation and immune responses. So it is good in those diseases in which you will see the inflammation and you will see the overactivations of our immune systems. So in our activations of the immune system, glucocorticoids reduce the immune response in those diseases like autoimmune diseases in case, and also used in the treatment of the autoimmune diseases, allergies, because in allergies there is a lot of inflammations, and respiratory conditions. So glucocorticoid is good in those conditions. Next is the mineralocorticoids. What type of mineral? For example, aldosterone and fludrocortisones. These regulate the sodium and the potassium balance in our body and maintain blood pressures and the fluid levels in the body. So these are the two most important corticosteroids, glucocorticoids and the mineralocorticoids. Next is the anabolic androgenic steroids, mostly misused steroids. It is actually a synthetic derivative of testosterone, and it has majorly two functions: promote muscles growth, on the basis of which we called it anabolic effect. And second is the enhanced male characteristic, that is androgenic hormonal effect. So it has two effects, anabolic and the androgenic, on the basis of which we called it anabolic androgenic steroids. Anabolic effects enhance protein synthesis in muscles, enhance muscles recovery and the strength during gym or some exercise, used medically for treating muscle wasting disease. So we can use it medically and in case of some athletes and the gyms. So that is the anabolic effect. Another effect is the androgenic effect, influence male characteristics such as deep voice, body hair, and the libido, means sexual desire. It increase these characteristics. Essentially, in male puberty and reproductive function, it enhance the male puberty and the male sexual characteristics. Next, we will talk about the mechanism. What mechanism that corticosteroids and the anabolic androgenic steroids do? Corticosteroids bind to the intracellular receptors, those receptors that present inside the cells, and regulate gene expression. So this is the most important thing. First thing, that is, after the binding of the corticosteroids with the receptor, it regulates the gene expression. It means that from the DNA, you will see the synthesis of the RNA. Okay. And from the RNA, you will see the synthesis of the proteins. And ultimately, proteins will perform the ultimate functions. So this is how corticosteroids play its function in the cell. First is the uh, glucocorticoid. Glucocorticoid is basically inhabit Glucocorticoids inhibit the productions of pro-inflammatory molecules like cytokines and the prostaglandins. By reducing the cytokines and the prostaglandin, inflammation will also be reduced. Suppress immune system activity, increase blood glucose level by promoting gluconeogenesis from non-carbohydrate source into the glucose. So these are the functions and how glucocorticoids uh, performs its function in our body. Next is the mineralocorticoid acts on the kidney to retain sodium and water while excreting potassium. Excrete potassium while retain the sodium and the water in our body. Helps maintain blood pressure and electrolyte balance. Next is the anabolic steroids enter the cells and bind to the androgenic receptors in the cytoplasm. Receptor and steroids move to the nucleus and regulate gene expression. Both corticosteroids and the anabolic steroids express the or regulate the expressions of the genes. And ultimately, you will see the muscles growth and the repair. Medical uses of these steroids. First is the corticosteroids in the medicine. As we have discussed, corticosteroids involved mainly in the reductions of the inflammations and the uh, immune systems. So that's why it is mostly used in the autoimmune diseases like rheumatoid arthritis, lupus, multiple sclerosis, respiratory diseases like asthma, COPD, and skin diseases, eczema and psoriasis, inflammatory bowel disease, Crohn's disease, ulcerative colitis, allergic reactions, anaphylaxis, and hay fever, organ transplant to prevent organ rejection. So this is where we use the corticosteroids in the medicines. Next is the anabolic steroids in medicines. As it is involved in the building of the muscles, so we mostly use in this aspects. For example, muscle wasting disorders like HIV, AIDS, cancer, cachexia, and delay puberty. So it has another aspect that is related to the androgenic or hormone related. So it involved in the uh, increase in the puberty in the boys. Hormone replacement therapy for testosterone deficiency and certain anemia to stimulate red blood cell productions. Misuse and abuse. And mostly anabolic steroids is misused due to enhance the uh, body performance. Reasons for steroids abuse: athletes' performance. Athletes use steroid to enhance strength, endurance, and recovery. Bodybuilding for muscle growth, obviously. Cosmetic enhancement. Use steroids to achieve a more muscular physiques that enhance the beauty of the man and the woman. Commonly abused anabolic. What anabolic steroids mostly abused? First is the testosterone, in which you will see the sustanon, cypionate, and ethantate, nandrolone, decadurabolin, stanozolol, winstrol, methandrostenolone, dianabol, and oxandrolone anavor. So these are basically the commonly anabolic steroids that is misused. Side effect of these steroids, specifically corticosteroids, it has short-term effects and the long-term effects. Short-term effects increase appetite and weight gain, mood swings, irritability, insomnia, restlessness, and elevated blood sugar levels, risk of diabetes. Long-term effects: osteoporosis, weak bone, muscles weakness and fatigue, high blood pressure, adrenal suppression. As we already give the corticosteroids from outside, synthetic form, even though the natural form also produced in our body. So ultimately, with the passage of the time, natural salt starts producing less corticosteroids in our body. Increased risk of infections. Side effects of anabolic. We have discussed corticosteroids. Now we will discuss the anabolic steroids physical effects like liver damage, risk of liver cancer and hepatitis, high blood pressure, heart disease and stroke, and severe acne and the oily skin, baldness, especially in men genetically predisposed. Hormonal effects in men: testicular shrinkage, gynecomastia, development of breast in the male, reduced sperm production and infertility. In women, deepening of voice, increased body hair, hirsutism, and irregular menstrual cycle. Psychological side effects: aggressive behavior, roid rage, mood swings, anxiety, depression, dependence, and withdrawal symptoms. Legal status and deregulation: corticosteroids prescribed only when widely used for medical conditions. Anabolic steroids control substances in many countries because it is the mostly misused steroids. Sports regulation prohibited by the World Anti-Doping Agency because it is not allowed in the sport, and banned in professional sports and the Olympics. Alternative to steroids, then without steroid, how can we increase the muscles? So we have lot of different options like natural protein supplements, whey, casein, plant-based proteins, creatine monohydrate, proven to enhance strength and muscle mass, branch chain amino acids for recovery, and proper diet and exercise for muscle gain and the endurance. So let's summarize the steroids that we have discussed. Steroids are organic compound derived from the cholesterol. It has both natural source and the synthetic. It has two types: corticosteroids and anabolic androgenic steroids. Corticosteroids has two types: glucocorticoid, for example, cortisol, prednisone, reduce inflammation and suppress the immune system. Mineralocorticoid, aldosterone, regulates sodium and potassium level in our body and maintains the blood pressure. Anabolic has two functions: muscle growth and the male characteristic. Mechanism: corticosteroids acts on the immune system and metabolism, reduce inflammation and electrolyte balance. Anabolic enhance the productions of the protein synthesis in our body. Medical use: corticosteroids used in inflammatory diseases, autoimmune diseases, and respiratory diseases. Anabolic is used in muscle wasting disease, delay puberty, and hormone replacement therapy. Misuse: anabolic steroids is mostly misused in the athletic performance and bodybuilding, and illicit steroids like testosterone, nandrolone, stanozolol are used for muscle growth, often leading to severe side effects. Side effects like corticosteroid, weight gain, high blood sugar, osteoporosis, and adrenal suppression. And anabolic like liver damage, high blood pressure, baldness, hormonal imbalances, testicular shrinkage, gynecomastia in men, and deep voice in women. Psychological, that is the aggressive, angry mood, that is the adverse effects. Legal status and alteration, corticosteroids are prescribed for medical use. Anabolic are controlled substances banned in professional sports, and safer alternatives include protein supplements. You can take the protein supplements, creatinine, and protein nutrients. So, conclude, steroids are valuable in medicine. Misuse, especially for of anabolic steroids, leads to severe health risk. Responsibility use under medical supervision is essential to avoid complication. So this is what are steroids, and when we have to take these steroids and when we have not to take these steroids. So this is all aspects of the steroids. But if you still have any question, you may ask in the comment section. Thank you so much.